Hello, my name is Dan Whitehouse. Today I'm joined by Dr. Sophie Richter and Dr. Virginia Newcomb, who are both academic emergency medicine doctors working in Addenbrooke's Hospital and with the University of Cambridge. Their research surrounds mild traumatic brain injury, and today we're going to be discussing this subject and their research. So firstly, Dr. Newcomb, what is a mild traumatic brain injury?
So a mild traumatic brain injury is commonly caused by a blow to the head. So this might be from a car accident or a simple fall or a sporting injury or even an assault. Unfortunately, it's really common. So every year, more than 1.4 million people will attend an emergency department after a mild head injury. So that is one injury every 22 seconds happening here in the UK.
So how is this different from a concussion?
So a concussion is classically thought to be a sporting injury, and whereas a mild injury is head injury is something that's not really thought to be due to sport, but actually they're just on the spectrum. They're really the same thing. It's just the mechanism that's different. The one thing that does distinguish sporting injuries from non-sporting injuries, though, is that people can often have them done repetitively. So if you head the football or you get tackled or so on, that's something that might happen frequently. And so there's a lot of research going on to see whether or not having just one head injury or having multiple head injuries can affect people in different ways.
So, Dr. Richter, how do these injuries affect patients?
This is a really important question, because when people hear the term mild TBI, they often think that all patients will recover quite quickly. But actually, we know now that up to 1/3 of patients after a mild head injury are left with some symptoms that can last for months to years. So that might include headaches, dizziness, problems with memory or concentration, depression and anxiety. So symptoms that really interfere with day-to-day activities, with people's work, and with their relationships with their friends and family.
1/3 of patients seems a lot. So what can we currently do for them?
Well, when the patients first come to the emergency department, our real focus is on identifying the patients who need urgent treatment through neurosurgery. So what we do is try to decide whether the patient needs a CT scan and then see if there's any visible injury on the scan. But unfortunately, the CT scan can't show us very subtle damage to the brain. So it can't tell us which patients go on to have these symptoms I described earlier. So at the moment, we give the patients advice and say, look, if you experience these symptoms and they don't go away within a couple of weeks, please go and see your GP. But we know that it's just the sort of symptoms that the patients are having that might actually prevent them from seeking help. If they feel overstimulated by loud noise, or they feel depressed or low or anxious to leave the house.
So it seems from what you're saying that there's a lot of scope to be able to improve this patient journey and the patient care. Dr. Newcomb, how is your research linked into this? How does your research look at this?
So as a group, we're really interested in seeing if we can identify patients who will have these symptoms for a prolonged period, because we know that there's a great need that currently isn't being met to try and help people after a mild head injury. So some of the things that we've been doing are, for example, doing much higher resolution scans than the CT that people commonly get in the emergency department. So it's something called an MRI. And so you can see over my shoulder this way, an example of something called tractography. And this is a very special technique that can allow us to see if there's any damage to the electrical wires or white matter pathways of the brain. And we have some evidence that that can help us determine which patients will have ongoing problems and who won't. And so we're hoping that by performing this type of research where we can identify those at higher risk, we can then start asking people to take part in clinical trials, so we can then start to have actual management and treatment of patients earlier after their injury to really try and improve the outcomes and care of these patients.
So that all sounds fascinating. If people are keen to get involved with your research, how might they do that?
So we're really keen to have anyone who is involved, who would like to be involved, And there are a couple of ways that people can become involved. So the first is, if someone is unfortunate enough that they do need to attend an emergency department, particularly in this region and particularly Addenbrooke's, then we may invite you when you attend to take part in one of our research studies. But we don't want to hear from people just when they've either just had a head injury. We also want people who might have had a head injury in the past, or just people who are interested to get in touch with us, so that we can make sure that the research questions we're asking are really those that are wanted by the community and really will make a difference to patients. And so the best way to get into contact with us is to either go to the website that we've got sitting on the slide here, or email us at that email address, and then we'll get back in contact with you.
Oh, perfect. Well, thank you very much for that, both of you. And I think we'll leave that there. Thank you.
Thank you.
Thank you.